great improvements have been made in IVF treatment, primarily due to advances in ovarian stimulation regimes and embryological procedures. However, in recent years, we have seen a plateau in the success of IVF, and attention has turned to the challenge of better understanding and facilitating successful implantation of embryos. Until recently, there has been less emphasis on the biological processes involved in implantation, and it has been aptly termed the black box of assisted reproductive technologies. The 2014 Annual Conference in Reproductive Medicine, Implantation, Opening the Black Box, aims to address this. We spoke with the scientific organisers, Professor Nick Macklin and Dr. Zsolt Nagy.
I'm a Professor of Obstetrics and Gynecology at the University of Southampton, also Medical Director of the Complete Fertility Centre here in Southampton. My primary research interests are human implantation, which I think is one of the big challenges that face us as clinicians as we try and improve IVF outcomes, but also the importance of preconceptional factors which affect fertility chances, but also long-term health of the offspring. I think this event is of particular interest to clinicians because it addresses what I think many of us recognise as being the major hurdle that lies between us and improving success for our fertility patients. That is, addressing human implantation. Up until now, we've been very successful in creating healthy embryos through IVF techniques, but our challenge is trying to get these embryos to implant. And because we've been trying very hard to do this for our patients, a number of empirical therapies have entered clinical practice which are not proven to be effective or, to be honest, based on sound science. And what this symposium allows us to do is to look closely at how we can use our increasing knowledge of the biology of human implantation to develop new and effective means of helping our patients conceive through IVF by improving implantation.
I'm an embryologist working at Reproductive Biology Associates. I'm the scientific and laboratory director, and this practice is located in Atlanta, Georgia, the United States. I work every day in the clinical routine in the embryology laboratory. There are many different reasons that I'm really excited about the upcoming meeting because the objective of that meeting is to look at one very specific point of infertility treatment, which is the implantation. And implantation of the embryo to the endometrium, it has been a kind of black box in the past because we didn't know very much about it. We were happy when we saw that an embryo implanted and the patient got pregnant, but many times when there was not an implantation, we had absolutely no idea what was the reason or what were the reasons. Today, with many new research and investigation, we have much more understanding about that. And in this meeting, there will be the most outstanding researchers and scientists who are coming and giving their view and presentation of their research to explain about what is this black box that is not anymore a black box.